Ouch, we have all been to the dentist, but how many of you can say that you've actually been checked out for oral cancer when you go in for a cleaning? This morning, I'm joined by a woman who has been spared a whole lot of pain, all because her dentist did this simple test. It's called Visalite Plus. Here to tell us about it is Dr. Melvin Pierson, and his patient is right here with Kathy Rigby. No, not the gymnast, but good to have you here anyway.
Thank you very much.
We're going to have you get to rinsing right away. Go ahead and start rinsing because it's going to take about 60 seconds. Doctor, what is she doing and why?
She's rinsing right now with a product called Visalite Plus, and what it does is right now she's taking a layer off of her gums and all that reflects some of the light. And what we're going to do is we're going to go in with a specialized light, and it's going to allow us to see oral cancer lesions that we normally would not be able to see with the naked eye.
Kathy, you tell me when you need to spit, and we'll take the shot away from you. Okay, turn around this way.
That's very discreet.
Maybe we won't take the shot away. Well, thank you, Kathy, for doing that.
My pleasure.
So why aren't all dentists doing this?
That's an excellent question, and that's a question your viewers should be asking their dentist. We all are trained in dental school to do oral cancer screenings, but you're only trained to do it with palpation, with touch, and some visual, but by the time you see it with the naked eye, the lesion is in the third or fourth stages. What this product does is allows you to see it in earlier stages, thus making it more treatable. You
mentioned the touching of her body. We'll get to that in a second, but tell us again what you're going to put into her mouth now. We'll take the lights down in the studio so we can see kind of what you're looking at. You need to use glasses,
these special glasses, yes. And what this light does, it's now going to reflect the cells in her mouth.
Okay, let's go ahead.
It's open, please, Kathy. And what it's going to do, it's going to allow the abnormal cells to jump out a lot more normally, especially with the glasses on. I don't have the glasses on right now.
I'm going to try to put these glasses over our camera that Bob is holding. See if this helps at all. Okay. Does that help? Bob, can you get in a little closer here?
So any abnormality she has right now would jump out more visibly with the dim lighting and with this specialized wand. If we do see an abnormal lesion, we can then perform a biopsy on it.
Do it again,
Doctor. That a lot. Do it again?
Yeah. We can kind of see it in there. So you have to have these glasses on to be able to see that.
Yes.
Should I ask my dentist for this?
You should ask your dentist if they're performing any type of oral cancer screenings. Yes, that is a very pertinent question. That's what your viewers should be asking, other than calling the dentist and say, what insurance do you take? Interview your dentist. Ask your dentist, are they doing these type of procedures?
Okay. Because I know when I go in to get my teeth cleaned, they've never brought this up.
Well, it is a technology that's out there. This is one system. There are several on the market, and yes, your viewers should be asking their dentist to do this procedure.
What is the diagnosis for Kathy here?
Kathy is fine. We did see something. We did biopsy it, and the biopsy came back negative, so Kathy is good. Now, based on the Academy of General Dentistry, we recommend doing this procedure once a year.
Once a year?
Once a year.
How much does it cost?
$65, $75.
Okay, so it's not overly
very
expensive.
Reasonably priced procedure. It's disposable, it's portable, it's affordable, and in some cases it's covered by insurance.
So when I make the appointment, just say, I want that Visalite thing.
Yes.
Now you mentioned it's not massage particularly, but you also don't just go into the mouth to check out somebody's dental health.
No. Tilt your head back a little bit. We massage here. We feel for any abnormal lesion. We feel here.
Would it be a lump?
It would be a lump, and is the lump movable? Is it not movable? And then you're going through a checklist in your head. When you go inside the mouth, open, you're feeling for certain lesions.
Turn around here just a little bit. There you go.
You're feeling for certain lesions, certain abnormalities. There's normal feel, there's an abnormal feel. We can tell which one it is. Then if we get an abnormal feel, we want to go to the next step to make sure that that lesion is not a cancerous lesion.
Kathy, you are one good sport, because it's not overly attractive to have a gaping mouth on television all over the Delaware Valley.
You're right.
You're a good woman.
Thank
and
you.
a good patient. Doctor, thank you very much.
So
again, it's something called Visalite. Ask for it.
Visalite Plus. Yes.
Visalite Plus. Thank you, Doctor.
Thank you.
Jenny?
Mike 840.